If you have ever had a urinary tract infection, you know how miserable they can be. The burning and urgency are usually the first signs that a UTI is coming on. Today we will be going over herbs that you can use to prevent a urinary tract infection or stop it in its tracks. Good morning, health-minded people. I'm Dr. Snow, and I teach you to be in charge of your own health, because other than God, no one knows as much about you as you should. Calendula is a lovely flower that grows nearly everywhere. This herb has antimicrobial and anti-inflammatory properties. It can also decrease pain and accelerate healing. It can be made into a salve to use topically for wounds, and when made into teas may prevent bladder infections or help stop them in the early stages. Do not take calendula internally if you are pregnant, as it may increase your risk of miscarriage. It may also decrease your ability to get pregnant, so if this is your goal, avoid calendula. Calendula is easy to start from seeds and grows in full or partial sun. While it is an annual plant, which means it only lives 1 year, it does self-seed, so if you allow some of the seeds to fall, it will come back next year. Harvest the flowers in mid to late morning after the dew has dried. Dry them in a dehydrator with the heat turned to less than 90 degrees Fahrenheit or using only the fan. You can also air dry them, but place them on a rack so they can get maximum airflow. This method will take a bit longer. Store the dried flowers in an airtight jar and in a dark cabinet, since sunlight can degrade the quality of any herb. You can make a cup of calendula tea and drink it once a day to prevent a urinary tract infection, but if you feel one coming on, increase this to 1 cup 3 times a day. It's time to see the doctor if you have symptoms that last for more than 3 days or if the symptoms are getting worse. If you have blood in your urine, if you have fever or chills, or if your urine becomes very dark or cloudy, it's time to go to the doctor. The elder plant is one of the most useful medicinal plants, and while it's not practical to grow inside, if you have a sunny spot in your yard, I highly recommend you putting in one of these bushes. Elderflower made into a cold infusion both stimulates the immune system to fight infection, but it is also a diuretic, which means it increases your urine output, and this helps you flush the bacteria out of your urinary tract. When making an elderflower infusion, do not use hot water, as heat can destroy the medicinal properties of the herb. To make a cold infusion, use 1 cup of fresh elderflowers in 4 cups of cool water. Let this set overnight or for about 12 hours. Strain and drink a cup of this once a day to prevent urinary tract infections, or 3 times daily if you suspect you're getting one. Store the infusion in the refrigerator, but do not keep it for more than 4 days, as it will lose its potency. If you're learning something new, please hit that like button. Parsley is another herbal diuretic that can help flush bacteria from the urinary tract to prevent a UTI or stop it if it is caught early. It is also anti-inflammatory, full of antioxidants, and may help your body fight infections more effectively. Parsley can be eaten, added to a smoothie, or made into a tea. Incorporating parsley into your diet on a daily basis may help prevent recurring urinary tract infections. Drinking a cup of tea 3 or 4 times daily, starting immediately when you suspect you're getting a UTI, may help stop it early. Parsley is easy to grow in a pot or in your garden. It is a biennial plant, which means it lives for 2 years, then dies. The first year, the plant will develop roots, stems, and leaves. The stems are usually short the first year. If grown inside, the plant may not develop flowers, but the second year, the plant can become bitter. To grow parsley, either purchase a plant at the nursery or plant a packet of seeds. Put it in a sunny spot, or it will grow in partial shade. Water it weekly or when the soil starts to get dry. While eating a small amount of parsley is fine if you're pregnant, do not take a medicinal amount, as it may increase your risk of miscarriage. Also, do not use parsley medicinally if you are nursing, since it can dry up your milk supply. If you're trying to wean your child, you may want to drink parsley tea for the same reason. I like teas, period. But I really like teas for UTI symptoms because not only do herbal medicines help your body fight the infection, they're made up of mostly water, which all by itself flushes the urinary tract to help prevent and fight the infection. Everyone should be drinking 10 cups or more of fluids every day just to stay hydrated. If you're prone to UTIs, you should be drinking more than that. If you suspect you're getting a UTI, you should be drinking at least 15 cups of water every day. If you would like to learn about UTIs in older adults, click here now. Stinging nettle is a weed that grows wild nearly everywhere in the United States. Many herbalists grow it in their gardens because of its wonderful medicinal properties, and you can grow it in a pot in your apartment. But be warned, it is called stinging nettle for a reason. The leaves and stems of this plant are loaded with hair-like needles that contain chemicals that cause painful yet harmless stings. This chemical is destroyed by very hot water, as when you make a tea, and by alcohol when you make it into a tincture. Also, drying the leaves to store long-term destroys the sting. If you choose to grow this inside your home, make sure you put it in a place where you won't accidentally touch it. While the FDA doesn't evaluate or endorse any herbs for medicinal purposes in the United States, the German Commission E, which is the equivalent of the US FDA, has approved nettle for the prevention of urinary tract infection and kidney stones. It has diuretic properties to help flush the kidneys. For prevention, 1 cup of nettle tea or 1/2 teaspoonful of nettle tincture mixed in 2 ounces of water should be drank daily. Increase this to 3 times daily if you think you might be getting an infection. Do not take nettle if you are pregnant, as it is reported to possibly cause miscarriage. If you are nursing, check with your physician before using it more than occasionally. As always, if you are on prescription medications, check with your healthcare provider before using any herb for medicinal purposes. If you have learned something new from this video but would like more information on growing your own medicinal herbs at home, I've created a playlist that will teach you how to do that. The link is right here. Thank you for joining me today to learn what herbs you can use to prevent a urinary tract infection or stop it early if you are getting one. Stay healthy, drink your tea, and have a blessed week.